now I'm in so much pain and I don't know what else to do and I don't know what's gonna happen next.
Oh, this pain is too much.
Had really not known much about the disparate care statistics when it came to maternal fetal medicine. Anger, I think, was the first emotion. If human life matters to you regardless, then these statistics should be overwhelming to the point that it keeps you up at night.
For me as a Black woman, walking into a clinic or any professional healthcare building, it definitely feels like I'm not being heard. When I was pregnant, I was 18, and so every time I would look at my piece of paper, they'll be like, yep, teenage pregnancy. It just seemed like, oh, it's just another young Black woman that's giving birth. I really felt alone during that time. The pregnancy itself, it was very easy. It wasn't until my water broke, it seemed like things started to go downhill. I had to try to get the nurse in there. She eventually did come, but then she said I had to wait for the doctor. I was already ready to push, and I could feel that I was ready, but they were like, no, you have to wait. So I waited, and it was time for me to push. And all I know is that I seen my daughter for a second, was able to touch her, and then she was out of my hands because she was choking. No one explained to me exactly what was happening. Personally, I feel like the reason why she was choking is because I had to wait. I feel like I have been completely stereotyped, and that is completely unfair. It's just something that I'm really getting sick of, to be honest with you.
I think there's always a difficulty when we have to balance what do we think is medically important and what is the patient bringing to the table that they think is important. There's factors that are always going through my mind of how worried am I about this medically? In my experience of training to be a doctor, there was a lot of training around how do we stay professional and distanced. I think anytime we create distances between people, we limit our ability to see each other's humanity, and we get entire populations of people who have different health outcomes solely based on a cultural construct of race that doesn't have biologic grounding. And we probably do a worse job the more different we feel from our patients or our families.
I've always had kind of a righteous anger with injustice and disparity. Black women, we don't get the acknowledgement that we're human beings, that our pain is real, that our problem is real, that we just need you to see us. What are we doing as a society, as a healthcare system to prevent this? Childbirth is childbirth, no matter what color you are, and so why is this disparity? Why is this happening?
We began a process of engaging with the community that we called dinner talks, which later would be comparable to a focus group. We went to Black mothers and babies in their neighborhoods, in their homes, in their communities, and we said, tell us what we need to know. We listened. And what grew out of that is the BHI, CAPE simulation training, and most importantly, the format of having a provider paired with a community advocate so that the training was simultaneous.
When I found out about this opportunity as a community advocate, I was drawn to helping in any way that I could.
In my BHI CAPE simulation, Monica Simmons was my community advocate.
We had this patient that was irate, was bleeding, like it was a real life experience. Bird kind of walked in and she didn't introduce herself. And I didn't know that that would be a trigger, but it triggered the patient. Like, who are you? What are you here for? Because so many times as patients of color, specifically Black patients, we don't get that.
She was there to support the family, but also to serve as my guide of, hey, Dr. Bird, I think that we haven't addressed this concern. Can we address this concern for the family? That was actually really critical in terms of how do you care for a person? How do we engage with people of color in a more empathetic, appropriate, human way and acknowledge the frank discrepancies in medical outcomes and get pointed critique on how we can do that better.
There should be a community advocate available to every provider every time they walk into a room. These community advocates are filling that gap and partnering with providers to help them provide that culturally responsive care. One of our respondents talked about how she was so intimidated coming into the system. A lot of our community members said that.
Most of the moms came to us either expecting or with children under 2 years old. My role was to help them learn how to advocate for themselves, to teach them just the healthcare system and navigating through it.
I became involved when Symphony was around 2 years old. To put it in short, I would say they were just my village that I didn't have, and a great experience to be with other women like me. The program is empowering. Before, I was always felt unsatisfied, always left with more questions and just not feeling understood. I use it pretty much everywhere now. If I feel like a provider is being too fast, I'm like, can we please slow down? Can you listen to me, please? Sometimes it's like, it's a click, like a snap, bringing them back to reality. Like, okay, like, I'm sorry, like, let me understand you.
It's mind-boggling at the outcome of when you just show someone how much you care, when they know that they're valued. The moms that came through the program had positive outcomes. We have 3 moms that were pregnant that delivered healthy babies against all odds, that didn't have to get C-sections, that didn't have to get sterilization or hysterectomies.
One of the things that has stuck with me since that day, and I think about every day that I'm in clinic, is the importance of some really simple, basic things, like the importance of introducing yourself by your name and your title, and why are you in that room with them, and what is your role. Now, I think about that every time I walk in a room. I think the BHI CAPE simulation is a training that is worth the time, the energy, the effort. This changes practice.
Anecdotally, we've heard from a great number of providers, I've got to change the way that I provide care. I realize now I have a lot of growth that I need to do. You cannot be a complete provider until you understand how to use adaptive communication tools and techniques to provide culturally responsive care.
Our cohort ended because funding ended. Their needs don't end there. We can't do it without funding.
What we're helping providers to do is be the best providers they can be, to give the best care.
You hear the Hippocratic adage of like, first do no harm. We think about that a lot technically. We know how to run codes. We know how to intubate a baby. But first do no harm also applies to how we are with each other as people fundamentally. And I think the BHI CAPE simulation is part of a path of first do no harm in terms of knowing what harm has been done and how we can move forward to try to make it better.
I'll never be the same. And you know what? I'll never not have the expectation that providers can do this work. I will help my community demand that. I will never stop fighting.